Welcome back to our three-part series. This is part 2, where we're going to be covering Original Medicare. This is provided by the Boulder County Area Agency on Aging, SHIP Medicare Counseling Program. You can contact us by calling 303-441-1546 or sending us an email at medicarecounseling@bouldercounty.gov. Original Medicare is Medicare Part A, inpatient hospital benefit, and Medicare Part B, which is medical benefit. We're going to go over premiums, copays, coinsurance, and what Part A and B covers. Under the original Medicare plan, which is Medicare Part A and B, you can go to any doctor, hospital, or clinic that accepts Medicare anywhere in the U.S. or the U.S. territories. It's nationwide coverage. There's no referrals needed for specialists. The decisions are between you and your doctor. No managed care. So if you are going to be traveling in an RV or you have family that lives in other states or you're a snowbird, this is probably the plan for you so that you'll be able to access care wherever you are in the U.S. with any doctor that accepts Medicare. So Medicare Part A is your inpatient hospital benefit. You have to be admitted into the hospital to be accessing Part A benefit. Part B is your medical benefit. It's what we think of as our healthcare coverage. It's doctor's office visits, emergency rooms, CAT scans, MRI, lab work. Enrollment into Part A and B must be done through Social Security. Under the original Medicare plan, Part A is premium free for most people. If you have worked 10 years or 40 quarters, you've paid the Medicare tax, and your Part A would be premium free. Social Security normally sends out a statement each year, or you can find it at ssa.gov or by calling Social Security if you're concerned about how many quarters you might have and whether or not you will have premium free Part A. Part B has a monthly premium associated with it. This year in 2024, that premium is $174.70 per month. There are deductibles and there are coinsurance costs, and there's no maximum out of pocket under Original Medicare if you only have Part A and B. If you had a $100,000 weekend at the emergency room, you're going to pay your portion of the costs. If that happens the following weekend, again, you would pay the portion that you're responsible for, and there's no limit on that. So we'll talk about coming up what you can do to cover that gap and what Medicare covers and what you're responsible for paying. The premiums in 2024, Part A and B premiums are paid to Medicare. Part A would be premium free if you have 40 quarters or 10 years of work history. Part B is $174.70. Part D is paid to a private insurance company. There are many Part D providers out there, and the premiums vary from plan to plan. Part B and Part D are both subject to income-related adjustment that would be paid to Medicare if it's applicable. And we're going to talk about that on the next slide. So this is called IRMA. It's income-related adjustment, and it's based on your tax return 2 years prior. So if you are a high-income earner, you may pay a surcharge on top of your Part B premium and on top of your Part D premium. If your income as married filing jointly is less than $206,000, you're going to pay the Part B premium of $174.70. However, if you're on your tax return 2 years prior, if you're enrolling, say you're enrolling in 2024, Social Security will look at your tax return for 2022. And if your income is greater, married filing jointly, than $206,000, if it's between $206,000 and $258,000, you will pay the Part B premium of $174.70 plus the surcharge of $69.90. you'll pay a $12.90 surcharge on top of any premium you may pay for your Part D plan. So just know that this is out there, and it's a rolling look back, so it may change from year to year. You may have IRMA one year and not have it the next year. You can appeal IRMA through Social Security. You have to continue to pay the surcharge while you're in the appeal process. If they find in your favor, then they would pay you back those funds. So know that this is out there, so you're not surprised by it. If you have questions about this, please do give us a call, 303-441-1546. Now on to what deductibles there are in 2024. Part A has a deductible based on a 60-day benefit period. The deductible, if you're admitted into the hospital, is $1,632. So if you spend 10 days in the hospital, you pay that deductible. If you're in the hospital for 30 days, you would pay that deductible one time. You can receive more than one Part A deductible in a year, depending on how far apart your hospital stays were. So if you were admitted into the hospital in January, say January 5th, and discharged on the 15th, you would have that deductible, the $1,632. If then you were readmitted into the hospital in April, you would have a new Part A deductible because you're in a new benefit period. Part B has an annual deductible. It's $240 per year. That annual deductible is waived for the preventative services like bone mass tests and prostate screening and mammograms and vaccinations such as flu shots. Part D has a maximum deductible this year of $545, and we'll talk about Part D plans a little bit more coming up. Coinsurance costs for Part A and B in 2024 when you access services. So Part A has that 60-day benefit period, and you pay that $1,632. If you were unlucky enough to be in the hospital continuously admitted for longer than 60 days, starting with day 61, you're going to pay a per day charge. Skilled nursing, you'll notice that skilled nursing here, it says that it's $204 a day starting on day 21. So we're going to talk about that on the next slide, but just keep that in your mind. Part B is an 80-20 plan. So Medicare pays 80% of the Medicare approved service, and you're responsible for paying 20% of the cost. There's something here where it mentions unassigned claims. Those are very rare to see, but we want you to know about it so you know how to ask the question. If a doctor accepts Medicare assignment, the doctor is saying, I will only charge what Medicare allows for that service. Some doctors will say, I take Medicare, but I don't take Medicare assignment. So I'm going to take your Medicare, but I'm going to charge you an additional 15% above the Medicare approved amount. It's rare to see, but you may see it in something like a specialty like neurosurgery. So it's good to ask the question of any doctors you might be seeing, do you take Medicare assignment? Okay, Medicare Part A, what does it cover? It covers your inpatient hospital care. So you have to be admitted into the hospital in order to be accessing Part A benefit. It covers hospice care, home health care, blood, and skilled nursing facility or rehab facility. Not long-term care, but this would be if you broke your hip, went into the emergency room, needed surgery, so they admitted you into the hospital, you had surgery, you've been in the hospital for a 3-day minimum qualifying inpatient hospital stay. This is important to note. You want to have a 3-day, it's called the 3 midnight rule. inpatient hospital stay in order for the first 20 days to be covered under Medicare at a skilled nursing or a rehab facility. So if you think you're going to be moving to a rehab facility after a hospital stay, make sure you have that 3-day inpatient stay. Ask, am I being admitted into the hospital? Because it's possible to be kept at the hospital, move to a room, be served meals, and be there under observation. We had someone who received a bill from a rehab facility after staying there. She didn't understand why she was being billed for those days that she stayed there, but she had been in the hospital under observation for 2 days, wasn't able to go home, and they moved her to a rehab facility. Just have somebody advocating for you and asking that question. You need that 3 midnights in the hospital as an inpatient in order to have the first 20 days at a skilled nursing facility or rehab covered. Medicare Part B covers pretty much everything else. It's going to cover your physical therapy, occupational therapy, speech therapy, mental health therapy, outpatient emergency room, MRIs, CAT scans, x-rays, lab work, doctor services. Something that might be new is durable medical equipment. It's called DME. That is wheelchairs, walkers, oxygen, some insulin pumps, CPAP machine, mostly anything that's considered durable medical equipment. The one thing to note with durable medical equipment is that you need to get that. Number one, you have to have a doctor's prescription, and then you need to receive the equipment from a Medicare approved supplier. You cannot order a wheelchair off of Amazon and expect Medicare to cover it. So under Part B in original Medicare, you'll pay the deductible. So the first time you access services during the year, you're going to pay that first $240. Beyond that, Medicare is going to pay 80% of the Medicare approved service, and you're going to be responsible for 20% of the Medicare approved service. So that could be a lot, and we'll talk about what you do to cover that coming up. Preventative services are designated in the Medicare and U book by a blue apple. We're not sure why they used a blue apple, but that is, when you see that blue apple, you'll know that it's a preventative services. So these are covered at no cost to you. It's going to be bone mass measurements, COVID-19 vaccinations. They've added Shingrix, which is a good thing. That was new last year because those are kind of pricey. Colorectal cancer screenings, if they go and they do a colonoscopy and it's just a look-see and they don't find anything, that's a preventative service. If, however, you have a colonoscopy and they snip a polyp, it then becomes a diagnostic service. They are moving to covering the colonoscopy with diagnostic service, moving towards 100% coverage. So this year, Medicare will pay 90% of that if it ends up being a diagnostic service, and you're responsible for 10%. Mammogram screenings and prostate screenings, those are preventative services. The annual wellness visit, this is just a conversation with your doctor. So imagine yourself sitting in your doctor's office, you're across the desk from him, he's asking you questions about your health and your well-being. Then you may move to an exam room and have a medical appointment. But the annual wellness visit is just a conversation with your doctor. Knowing what is just as important as knowing what is covered. So what's not covered by Medicare currently is healthcare outside of the U.S. or concierge care, routine hearing and hearing aids, routine eye care and eyeglasses. So if you're going to Target for a new prescription on your glasses, Target or Walmart, That is not covered by Medicare. If you have glaucoma and you're seeing an ophthalmologist, or you have cataracts and you need surgery, you'll be seeing a medical doctor, and that would be covered under Part B. But routine eye care is not covered under original Medicare. Routine dental care and dentures not covered by Medicare. We hear all the time people say, I'm going to have Medicare cover my long-term care. Medicare does not cover long-term care, does not cover custodial long-term care. Acupuncture, we've added it down here on the bottom. It's covered under very specific circumstances related to lower back pain. So some Medicare Advantage plans have an acupuncture benefit, like 12 visits a year, but that's a good question to ask if that's something you're interested in. So what do you do to protect yourself from that 20% gap between what Medicare pays and the costs that you're responsible for? So if you're going to stay with original Medicare, there are some ways that you can cover those costs. One would be to purchase a secondary insurance policy called a supplemental insurance or a Medigap plan. It's called Medigap because it picks up the gap between what Medicare covers and what you're responsible for paying. You may have retiree coverage, you might have TRICARE for Life or Federal Employee Health Plan or union coverage, or you might have low income and qualify for Medicaid to pick up those costs. We're going to talk a little bit more in detail about the Medigap and supplemental insurance policies so you can understand how those work and which plans you might be interested in. So Medigap plans are sold by private insurance companies. They're standardized nationwide and accepted nationwide. Like original Medicare, you can go to any doctor that accepts Medicare anywhere in the U.S. or the U.S. territories. So your Medigap would travel with you where your Medicare does. You can change these plans anytime, and we have in big letters here, but you may be subject to medical underwriting and you could be denied. So these companies, once you leave your guarantee issue period, do not have to sell you a plan. They can deny you coverage based on your answers to those medical questions. There's a secondary policy, not your primary insurance, which is why they can do that. So you have a guarantee issue period the first 6 months that you have your Part B coverage of Medicare, meaning you can choose a plan, you can enroll with that plan. The company will just enroll you. They won't ask you any questions. As long as you pay those monthly premiums, they will never drop or deny you. So if you have delicate health, or you know everybody in your family develops cancer at the age of 70, the time to purchase a Medigap is when you're first eligible for Medicare. So this chart shows the different types of Medigap plans that are available to purchase. So if you think about Medicare, Medicare is a part. It's Part A, Part B, Part D. These are Plan A, Plan B, Plan G. Can be kind of confusing, but when you get the language down, then the insurance agents or anybody you're talking to will know which you're talking about, whether you're talking about Medicare, a Medigap, or a Medicare Advantage plan. So these are plans. Plan G is the most comprehensive plan you can buy currently if you're just turning 65. The more check marks, the better. The only thing that Plan G does not cover is the Part B annual deductible of $240. You pay the first $240. After that, Medicare is going to pay primary. They're the approver. And then the Medigap is going to pay secondary. They're going to pick up those other costs. So you remember that $1,632 inpatient Part A deductible that you pay? This plan pays that right here. There's a check mark right there. These plans cost about if you're female, it's about 120 per month at the age of 65. For a male, it's probably closer to about 150 per month. They do go up each year about 3 to 5%. So as you age, the premiums will increase over time. Some people do like the Plan N. It's a little bit less per month than the Plan G, but you're deferring the cost because you're paying $20 every time you access a service. So the best example of that would be if you have physical therapy appointments twice a week for the next 6 weeks. Every time you see that physical therapist, you're going to make a $20 copayment. So sometimes, depending on how often you access services or how many doctors you see, it might be less expensive overall to go with a Plan G. If you don't access that many services, a Plan N might be a better bet for you. Plan C and Plan F are no longer accepting enrollment unless you turn 65 before January 1st, 2020. The smaller the pool of people in those plans, Plan C and Plan F, the higher the premiums are going. So you're probably better off with a Plan G anyway. What else do I want you to know about these companies? When you're looking at Medigap companies, you want to stay with a large health insurance company whose name you recognize, that is going to have a lot of enrollees. More enrollees that they have, the more consistent the premiums stay from year to year. They have a good balance of healthy to non-healthy folks. If you have questions about these Medigaps, we can answer these questions. We can provide you with a list of questions that you might want to ask these companies when you're doing your research. We cannot help you enroll into one of these plans because it's secondary to Medicare. But we're happy to help you sort through the companies and the plans to find out what might be best for you. So how easy is it to move from original Medicare with a Medigap to a Medicare Advantage plan in the future? Easy, very easy. Any year during the annual enrollment period, October 15th through December 7th, you can choose to enroll into a Medicare Advantage plan. The new plan will start January 1. No questions asked. Okay, so under Original Medicare, we have enrolled in A and B, and we've added a Medigap plan, supplemental coverage. The only thing left to do if I'm staying with Original Medicare would be to enroll into a prescription drug plan. Medicare Part D plans, Medicare prescription drug coverage. These are provided by private insurance companies that contract with Medicare. These are for medications that you take at home, ones that you're picking up at the pharmacy. So you're going to CVS, Walgreens, King Soopers, Safeway. You're going to a pharmacy, you're picking up your medication, you're taking it at home. So Medicare Part D plans, these plans all have a monthly premium. They vary widely in 2024, anywhere from $0 all the way up to $130 per month. It just depends on what medications you're taking. You just want to make sure that whatever list of medications you have, it's on the plan's formulary. Every drug company has its own formulary of medications that they cover. You want to make sure that your list is on the plan of the company that you're enrolling with. In 2024, there's an annual deductible of $545. Some plans have less. It varies from plan to plan. You want to watch out for prior authorization, step therapy, and quantity limits. So prior authorization, not usually a big deal. It's a matter of your doctor faxing information in to the company in order to get that authorization. If you see step therapy, that might be a little bit more concerning because what that means is they want you to try 2 or 3 other medications before giving you the one that you have been prescribed. These are strictly for drugs that you're picking up at the pharmacy and taking at home. Now, way back when you were listening to the first part of this series in enrollment, you had your initial enrollment period to enroll into A and B, or the special enrollment period in which you have 8 months to enroll into Medicare Part A and B. Part D, they only give you 63 days to enroll after you lose creditable coverage to avoid penalty. Now, the penalty for Part D is much less than the Part B penalty. It's only 1% per month for the number of months that you didn't enroll when you should have enrolled. It's calculated by Social Security, if that is you. It's also a lifetime penalty, so it ends up to be about, right now it's about 35 cents per month for each month that you didn't enroll when you should have. If you do not enroll in a drug plan when you're first eligible, you will only be able to enroll during the annual enrollment period for a January 1 start. So if you don't enroll in a plan and come July, you need medications and you need coverage, you wouldn't actually be able to get it until the fall annual enrollment with a January 1 start. So now that there is one drug plan that has a 0 monthly premium, even if you don't take any medications, there's no reason not to enroll in that 0 premium plan, just to avoid the penalty, to make sure that you have coverage in case something is to go wrong and all of a sudden you need medication. We can help you review prescription drug plans. We do this all the time. We are very familiar with how the plans list their cost sharing. So just give us a call. We can also help you enroll into a Part D plan because it's a part of Medicare. 303-441-1546 is our number. This is just a list of the prescription drug plans that are offered in Colorado this year. Down here you'll see is the 0 premium plan. And up here we have one that's $132 a month. What's the difference between those plans? It'll be mostly your list of medications and which plan is going to cover those the best, what's going to cost you the least amount over the year. So again, give us a call. We are happy to help you review this in detail. And we're very familiar with the companies and the different options with the plans. It's important to note that Part D cover some chemotherapy and immunosuppressive drugs because they're covered under Part B. So anything given by injection or infusion in a doctor's office is going to be covered under Part B as in boy of Medicare, not D as in drug. So if you are going to Rocky Mountain Cancer Center and you're receiving infusions, chemotherapy infusions, that's going to be covered under your Part B benefit. If you receive an oral chemotherapy medication that you take at home, that would be covered under Part D. Part D also does not cover any vitamins or over-the-counter drugs. It doesn't cover any weight or loss or gain drugs, no sexual dysfunction or fertility drugs, and no cosmetic drugs. So if you currently have prescription drug coverage, is it creditable? Most companies send out that letter each year letting you know that their coverage is creditable. Some retiree plans and COBRA plans have creditable coverage within their plan. You need to verify if you're over the age of 65 that your whatever drug plan you have is a creditable one. As long as you have that creditable coverage, you'll not be penalized. And remember that there's a special enrollment period of 63 days to be enrolled into a Part D plan after your current coverage ends. This is the Medicare.gov website. You can do Part D plan research if you'd like. You would click on that tab that says Find Health and Drug Plans. If you have a Medicare number, you can create an account and do a personalized search where it will hold that information. Otherwise, you could list your zip code and do your research that way. Easiest way, of course, is to call us and have us do all the research for you. The picture on this Medicare.gov website changes, seems like on a monthly basis. So this lovely lady is not there right now. There's a new picture. But if you have any questions about that, give us a call. We can help you do the research on drug plans. We can help you enroll into a drug plan because it is a part of Medicare. So that's the end, folks, of part 2. Part 3, we'll go over Medicare Advantage plans in detail and how those work and what you pay, what it costs you, what it covers. Call us at 303-441-1546 if you'd like to set up a one-to-one appointment because you have questions about part 1 or part 2, or even if part 3, if you finish that. We are always here to help you. Thanks.